Hormonal replacement therapy is a treatment to relieve a symptom of the menopause. It replaces hormones that are at the lower level as you approach the menopause. In a time of menopause, there is ovarian atrophy. Ovarian atrophy lead to loss of the hormonal loss, like estradiol, FSH, LH increasing. So the hormonal replacement therapy to replace this hormone that is deficient or decreasing during menopause. Benefit of HRT, of hormonal replacement therapy. There is multiple benefit of hormonal replacement therapy. The main benefit of HRT is that it can help to relieve the most of the menopausal symptoms, such as hot flush, night sweating, mood swing, and vaginal dryness. Many of these symptoms pass after a few years, but they can be unpleasant, and take hormonal replacement therapy can offer relief for many women. Menopausal symptoms like hot flush, night sweating, vaginal dryness, urinary tract infection or urinary tract symptom, all these symptoms occur during menopause. So the hormonal replacement therapy relieves these symptoms, most of these symptoms. It can also help to prevent the weakness of the bone, like osteoporosis, which is more common after menopause. Like benefits, there is a risk for HRT. First one, breast cancer. First risk, breast cancer. Women who take HRT for more than 1 year have a higher risk of breast cancer than a woman who have never used. The risk is linked to all types of HRT except vaginal estrogen. For women in their 40 and 50 years old who take HRT for 5 years, there will be one case extra increasing of breast cancer. So all types of hormonal replacement therapy associated with increasing risk of breast cancer, except local estrogen therapy or local vaginal therapy. Second risk, ovarian cancer. It's thought that if there is any increasing in cases of ovarian cancer among women taking HRT, the increasing is very small. Endometrial cancer. The third, endometrial cancer. Estrogen-only hormonal replacement therapy can increase the risk of endometrial cancer, but taking combined HRT, particularly a course of continuous combined both medicine without regular break, largely eliminate this risk. So estrogen-only HRT increase the risk of hormonal replacement therapy. But when used combined, hormonal replacement therapy show decreasing the risk of endometrial cancer. The fourth risk, blood clot or thrombus. Blood clot can be a serious if they become locked in a blood vessel and blocked a flow of the blood. The evidence show that taking of HRT can increase the risk of blood clot. There is no increasing of the risk when the HRT use, such as patches or gels. So only increase risk when use systemic HRT, like injection and tap. The risk increasing about 4 times higher than normal for women who not taking HRT. The fifth risk هو heart disease or heart or cardiac disease and stroke. The evidence shows that HRT doesn't significantly increase the risk of cardiovascular disease when started before the age of 60 years old. Estrogen-only HRT is associated with no or reducing risk of HRT, but combined associated with little increase in the risk of the heart disease. So estrogen-only HRT associated with no or decreasing the risk of cardiac problem or stroke. Who can take HRT? All menopausal women take HRT? No. Most women can have HRT if they are having symptoms associated with menopause. But HRT may not be suitable if menopausal women have first one, history of breast cancer, ovarian cancer, or endometrial cancer. So the contraindication for HRT, first one, his patient has history of breast cancer, ovarian cancer, and endometrial cancer. Second one, history of blood clot or thrombus. Third one, have untreated high blood pressure or uncontrolled high blood pressure. Fourth one, have liver disease or hepatic disease. And the last one, when are pregnant, it is still possible to get pregnant while taking HRT. So, should use contraceptive for 2 years after the last period. These all the contraindication for HRT. First one, history of breast cancer and ovarian cancer and endometrial cancer. Second one, blood thrombus. Third one, history of untreated or uncontrolled blood pressure, history of liver disease or hepatic disease, and the last one, when the patient pregnant. Contraceptive should be used for 2 years after the last period in the patient less than 50 years old, and 1 year, and after 1 year for the patient more than 1 year, for more than 50 years old. What are the hormones used in hormonal replacement therapy? Hormonal replacement therapy replaces the hormone that the woman body no longer produces because of the menopause. The two main hormones used in HRT are, first one was estrogen. Types used either estradiol or estrone or estrogen. First one, estrogen. Second one, progesterone. A synthetic version of the hormone progesterone, such as dirogesterone, medroxyprogesterone, northisterone, and levonorgestrel. These are two hormones producing by ovarian tissue before menopause. So the hormonal replacement therapy replaces these two hormones, estrogen and progesterone. Hormonal replacement therapy involves either taking both of these hormones combined, either both, or just taking estrogen. Estrogen only HRT. Most women take combined HRT because taking estrogen on its own can increase your risk of developing of endometrial cancer. So the taking progesterone alongside with estrogen minimizes this risk. Estrogen only HRT is usually recommended for women with no uterus or with hysterectomized uterus. So these two hormones using for hormonal replacement therapy, either estrogen or progesterone, when used use two hormones named combined HRT, or just estrogen only HRT. Ways of taking HRT. First one, tablet. One of the most common form of HRT. They are usually taken once a day. Both estrogen only and combined are available as a tablet. For some women, this may be the simplest way of having a treatment. So the most common hormonal replacement therapy using tablet, either combined hormonal replacement therapy or only estrogen hormonal replacement therapy. Second one, skin patches. Skin patches are also a common way of taking HRT. Stick the patches to hair skin and replace them every few days. Present either estrogen only HRT or maybe combined HRT. The third way, estrogen gel. Estrogen gel is an increasing popular form of HRT. It is rubbed on hair skin once a day. Like patches, gel can be convenient a way of taking HRT and doesn't increase the risk of blood thrombus or blood clot. Estrogen, local estrogen or vaginal estrogen for relieving a local symptom, vaginal dryness or urinary symptom. Implant. HRT is also used as implant, which is inserted under skin. Inserted under local anesthesia, either estrogen only or combined hormonal replacement therapy. Vaginal estrogen presented either a cream or pessary or ring. Inserted inside vagina, it is helped to relieve a local symptom like vaginal dryness or urinary symptom like a vaginal gel. So it doesn't carry the risk of HRT, and it doesn't increase the risk of breast cancer and doesn't increase the risk of endometrial cancer. So it can use without progesterone. The third hormone used with estrogen and progesterone, the testosterone. Testosterone is available as a gel that used onto the hair skin. It is recommended only for the women who have low sexual desire or sexual or decreased libido. It is usually using alongside with another type of hormonal replacement therapy. Not all women using testosterone, only patients with decreased libido or decreased sexual desire use testosterone to increase the libido or increase sexual desire. Now, hormonal replacement therapy treatment routines. The treatment routine for HRT depending on whether she is in early stages of menopause or she had menopausal symptoms for some times. Either cyclical, the routines either cyclical or sequential or continuous combined HRT. So the routines or the rules of use of HRT depending on the stage of menopause, either cyclical or continuous. Cyclical, the same as sequential. Cyclical HRT. It is also known as a sequential HRT, recommended for women taking combined HRT who have menopausal symptoms but still have their period. Cyclical for women have symptoms of menopause but still have a period. Type of cyclical HRT, either monthly HRT, you take estrogen every day and take progesterone in the last 14 days of your menstrual cycle, of her menstrual cycle. First one, 3 monthly HRT, take estrogen every day and take progesterone alongside for 14 days each 3 months. So either monthly HRT, use estrogen along the day and use progesterone in the last 14 days of menstrual cycle, or 3 months, use estrogen every day for 3 months and use progesterone in the last 14 days, each 3 months. Monthly HRT is usually recommended for the women who are having regular period. 3 monthly is usually recommended with irregular period. The second one, continuous combined HRT. Continuous combined is usually recommended for postmenopausal women. Postmenopausal women. Women said to be menopausal, postmenopausal after 1 year from the last period. For 1 year from the last period. So continuous combined involve taking estrogen and progesterone every day without a break. Every day, take estrogen and progesterone without a break. So there is no withdrawal bleeding. Usually used for postmenopausal women. Postmenopausal women. Postmenopausal women have the last period after 1 year. Side effect of HRT. As any medication, HRT can cause many side effects. But this will be usually passed within the 3 months of starting treatment. The common side effects including breast tenderness, headache, feeling sickness, indigestion, abdominal pain, and vaginal bleeding, regular vaginal bleeding. These are all the side effects of HRT. Alternative to HRT. Sometimes there is a contraindication for HRT. So there is alternative to HRT. What are the alternatives to HRT? First one, lifestyle measures, such as exercise regularly, eating a healthy diet, cutting down of the coffee, alcohol, and spicy food, and stop smoking. First one, lifestyle measures. Second one, tibolone. This is a medicine that is similar to the combined HRT, estrogen, and progesterone, but may not be effective. It is only suitable for the women who have their last period more than 1 year ago. Third one, antidepressant drug. Some antidepressant drug can help with hot flash and night sweat. They can cause unpleasant side effects such as agitation and dizziness. The fourth one, clonidine. It is a non-hormonal medicine that may help to reduce hot flash and night sweat in some women. And the last one, sometimes may be used only progesterone therapy. Progesterone therapy like Premolute, Normolute, and Provera can be used as alternative to hormonal replacement therapy. But it is associated with irregular vaginal bleeding. So these all alternative to HRT when the women have contraindication for using hormonal replacement therapy. First one, lifestyle measures. Second one, tibolone, antidepressant drug, and clonidine. And the last one, who only progesterone injection or only progesterone tab. Thank you. Any question?